a little bit, but that's normal because he works both sides, but normally your arms are just a little bit more forward the more you work out. Okay, so nice and relaxed for me.
Like an 8.
Here is his AC joint. Here is his glenohumeral joint. So this, the stable arm attached to my goniometer, must be stable. This is my movement arm. Okay, so this is the one that moves with the actual humerus itself. Okay, what I do is I normally set myself up in this position. Right, there we go. Okay, so I set myself up, and that's my stable arm. Now what I want you to do is I want you to take this thumb forward. I want you to bring it up as high as you can.
Doing abduction?
Nope, that way. Yep, flexion. Okay, I'm holding it here. Okay, and what I'm going to do is I'm going to make sure that this travels all the way with him. I'm going to go all the way up to his elbow again. And so here we're probably at a little eye tilted. I'm sorry. Come back down again. I'm trying to do it so she can record. Let me get down here. Okay, so here I am.
Go behind Chelsea. All right.
This would be normal. Feet forward. So that's where I am. Okay. I want you to go up one more time. Much as you can. Much as you can. Much as you can. Good. He is right at 185 or.
185.
Oh, I'm sorry, 175. So when I come up here, okay, he went from 0 to 175.
Okay.
Okay.
Good job, John.
Extension will probably be a little tight on him. Why? Because he sits forward just a little bit, and that happens because people are physically active. Same idea.
Posture.
Okay. I could be in this position. Why? Because he's only going to go up to 60. So as long as I go to 60, that's his max. So as long as my fingers aren't anywhere near 60, I can hold him in this position and say, bring your arm back. Okay. And he is at 49.
You kind of came out
49,
a little bit
50.
though.
And I might have, because I'm trying to make
No,
sure.
not you, him. Like when
Okay.
he brought his.
And he may be compensating. Okay? It happens. Alright? I'm going to have him turn
We're
this
only
way.
human.
Okay? Remember, where is my glenohumeral? Well, if you don't know, come in here and palpate. It is not here. It is not here. Okay? It is here. Okay? So as it's here, and he's going to come up here, he's going to hit me. So I have to be in front of him. Okay? So here I am, right here, lining myself up with my elbow. Okay? I can palpate this to his side and say, take this all the way up for me. As far as you can go, far as you can go, far as you can go. And he goes a little bit more than normal. So I'm going to put him at 183. Okay? Here, you do not have to measure it. This is adduction. But if I wanted to, okay, I would put him in the same position. Okay? I would be here, right, and I'd have him go that way. And I would follow his elbow. And now you're compensating. But you can't push it this way. Okay, so you have to be stable. Okay, so that's what I would do. I would move in this way. I usually don't do that. Why? Because people have breasts, male or female. Okay, maybe they have too much muscle tone, so I usually don't do that. My next
I have a
one
little bit of both.
is my rotation. So I'm going to put him on a table. On your back, shoulder to knee, please.
Oh.
Okay, there's a couple ways of doing this. Okay, some people, can you slide that way or that much? Good, don't fall off my table, please. Some people put him in this position, okay? They put their goniometer here and they measure the external rotation. This is the only way you can do it. Why not internal rotation? Because we hit the body, okay? Other people put him in this position, like this, and then they measure it from here, right? So here I am here, and I say, okay, take this and bring it all the way back. As far as you can go, as far as you can go, as far as you can go. And then I line myself up. He's a little bit more than 90, I would assume. Mike, what's that number?
110.
110. Okay, so he goes back a lot more than he should. Okay, if I want to do the other way, I move me, not my patient. Okay, hold that position, right? I'm here, and I do the same thing. Can you go that way? I use my arm so that I'm stable. And he's about 83. Okay, which is normal. 80 to 90 is normal. Okay, this should be 90 to 100. He was a little more than 100. Okay, so that's how you do it. So if you're doing flexion, you're at the side. Extension at the side. Abduction, ABD, you're in front, finding where it is. Remember, it's not here, it's not here, it's right here. Okay, and you're at the side doing your measurement. Okay, other things that you can also do is horizontal, but horizontal I have to have him sit. Come on. On a chair again. I typically need a stool. You know what? I'm going to put you on this little one. Sit here, please. Just sit here. was doing his right shoulder, so I'm going to continue to do his right shoulder. Okay? Nope, nope, nope. Okay? Want you to do this. Okay? And I want you to keep that position. I'm going to bring him forward just a tiny little bit. Good. So what I want to do is I want to make sure his shoulder blade and his arm form one long line. If he's back here, it's shoulder blade and then the arm. And I don't want that. I want it to be nice and smooth. So I'm going to put him right there. Okay? This goes here, nice and easy, and I say bring this as far that way as you can without moving your back. Good. Keep going, keep going, keep going. Good. And so I have him there at about, maybe 95. Okay? Come back, line him up appropriately. He's going to be right there. Okay? And what I'm going to do is change my hands and say bring it back for me. Okay? And go from there. So here I've got him at about 45.
What do you mean not move your back? Like, I feel like my back moves.
Don't rotate.
Don't rotate your shoulders. Okay, so let's say that I have a patient who does that. Okay, so as soon as I have them do this, this is what they do. I say, okay, keep your back straight, and I want you to do this. Okay, some people have a problem with that. If that's the case, I'm going to put them up against the wall. And I say, when you do this, I want to make sure that this side of your back is touching the wall. Okay?
Okay.
All right.
Now, granted, the shoulder blade rotates, so please don't worry about that. That will happen.